Thank you, James. Good morning. As we begin another week of changes and challenges, and I'll remind you it was just a little over 2 weeks ago that we first gathered here when the outbreak was detected at the nursing home in Kirkland. A lot has happened at that time. As we begin another week of challenges, I want to first extend our condolences to the families of those who have passed away from this pandemic and our concerns for those who continue to recover. Now, as you know, last week we announced public health directives that were intended and are intended to slow the rate of infection in our community and to give our hospital systems time to ramp up and to prepare. I am grateful for the millions of people around this region who have answered the call, who've turned their lives upside down and changed the way they work and travel and provide for their families and the well-being of their neighbors. But it was clear to me late last week and over the weekend that we must do more, that not all people are practicing appropriate social distancing and good health practices in every situation. We are at a critical moment in this crisis. We're leaving the phase of COVID-19 outbreaks in concentrated areas of the county, and we're entering the phase of potentially rapid and widespread infection. As public health experts from King County and the state conferred yesterday on next steps, it became clear that we needed to update the local health order that we put in place with additional social distancing measures. Beginning today, March 16th, we will implement new directives governing events, restaurants, social establishments, retailers. These are serious actions, not taken lightly. These are tactics needed to provide for the safety of our community, and our public health officer, Jeff Duchin, will be able to speak more about the details in a moment. We will be continuing to consult with all of our cities. There are 39 cities in King County about additional actions they believe they need to respond to local conditions in their jurisdictions. I want to take a minute to thank Dr. Duchin, Public Health Director Patty Hayes, and their team. They are working around the clock for our community. It is time right now for people to assume that they and everyone they meet has been exposed and is potentially infected, to avoid any unnecessary interactions that might lead to further infection, and to wait and monitor and see if they in fact have been infected so that they can isolate and recover without presenting a danger to others. Go to work if you must, but hunker down if you're able. Postpone anything you can. Treat the next 2 weeks as a period of self-quarantine to protect yourself and the lives and health of your loved ones and of our community. I am well aware of the hardships we've asked our residents to endure. And while I'm heartened by the support and understanding of so many people across the region, I also appreciate the anxiety felt by many in, for example, the restaurant and entertainment industries. Back in World War II, there was a national push for people to buy war bonds. In that same spirit, I'm urging everyone to patronize their local restaurants and coffee shops at a safe distance. If this pandemic is symbolized by the medical mask, then perhaps our resilience is going to be represented by the takeout box. I also ask you to join me in supporting the arts. If you plan on donating to an arts organization anytime this year, please do it now and take the time to donate to one of the many charities that's helping the people who are employed in the arts to get through this period. People have been put out of work either because they're artists or because they work backstage in the arts, to be able to pay their rent, to be able to put a meal on the table. And if your event is canceled, whether it's a charitable event or an arts event, please don't ask for a refund if you can afford it. These organizations need those funds to get through this time right now. Consider your ticket a contribution to a worthy cause. We can all play a small part in helping our economy and our neighbors, helping them hang on until the day we can lift these orders and eventually get back to life as normal. Today we are focused on the response, but in the coming weeks we must also focus on the recovery. It is my honor to introduce to you the Governor of the State of Washington, Jay Inslee.
Good morning. I want to thank members of the media who are accommodating our need to socially distance. We appreciate your cooperation and not shaking hands and maintaining 6 feet to the extent humanly possible. We thank you for your leadership in this statewide and national effort. Given the explosion of the COVID-19 virus in our state and globally, I will sign a statewide executive proclamation later today temporarily shutting down restaurants, bars, entertainment, and recreational facilities. This order is operational for 2 weeks and obviously may be extended. The reason is quite clear. We represent about 2% of the population of the United States, but we represent over 20% of the infections. Today it's 796 infections. Never since World War II have we faced a situation like this where we both can be part of this battle, but must be part of this battle. This is bigger than all of us, and I am fully confident that Washingtonians will rise to this challenge to get back to a normal state of our life as soon as humanly possible. But all of us have to recognize for the next several weeks, normal is not in our game plan. And I will be announcing both mandatory rules in this regard and a request for Washingtonians to understand that central premise. As Dow said, these decisions are not taken lightly. I know there are enormous economic implications and social disruptions. And in the days to come, we will attempt to do everything we can to minimize and help mitigate some of these challenges. But today, we know we are doing this for a simple reason, to save lives of our loved ones in Washington. And I want to reiterate here, hours count. It's not that weeks count, hours count. And so we need very strong measures to reduce the extent and pace of this infestation. This is our only weapon available to us right now. I want to reiterate that. We are not powerless against this virus, but we have one effective means of defeating it, and that is distancing ourselves from virtually everyone else in the state of Washington. Restaurants will still be allowed to provide takeout service and delivery services, but no in-person on-site dining or drinking of alcohol or coffee or anything else will be allowed under this order. Sit-down food services at colleges will be prohibited, but they will have the ability to have what you might think of as grab-and-go or in-your-room dining. The ban will not apply, obviously, to grocery stores and pharmacies. Other retail outlets that can play an enormous role in this must designate an employer or officer to implement a social distancing plan for the operations of their business. So I want to go through what is included in this ban. Restaurants, except for takeout and remote delivery. Food courts, bars and taverns, coffee shops, donut shops, ice cream parlors, wine and beer tasting venues, breweries and distilleries, beauty salons, barbers and nail salons, tattoo parlors, theaters, bowling alleys, gyms and fitness centers, non-tribal card rooms, museums and art galleries, youth sports and youth clubs. Permitted to continue, among other things, are grocery stores and pharmacies. I do want to be clear about this, though. The supply chain is strong today, and grocery stores will continue operating and providing services to Washingtonians. And I want to thank people in that industry for working day and night to make sure that that will continue. We all are in this together, and we don't want to stress the supply chain unnecessarily. So when you purchase things, this is a moment to think of your neighbors, not just your immediate family, so we can keep this supply chain open. We're keeping open pharmacies, child care and daycare facilities, school-based food programs for K through 12, convenience stores, and banks. As I mentioned, food or beverage services must move to delivery, takeout, or grab-and-go service, even at airports and in dorms. Additionally, all gatherings for social, spiritual, or recreational purposes with over 50 participants are prohibited, and all similar gatherings under 40 participants are prohibited unless previously announced criteria for public health and social distancing are met. Now, that is an order of the governor, but I want to speak to every leader of any organization, private or public. If you're thinking about having a group with 49 people in the same room, think again. You need to figure out how not to have meetings of any size if there is any possible opportunity to get your work done in a different way. We need your leadership more than ever to make sure that that fundamental common sense rule is followed. This morning I spoke with other governors to the president and the vice president and some of that leadership. There was a wide variety of subjects discussed. The one that is particularly important to the state of Washington is the maintenance of our personal protection equipment for our medical system and our hospitals. This is something we are very concerned about. The federal stockpile that has hundreds of thousands of personally protective equipment has been responding to our orders, but we are going to have to increase our orders fairly significantly, and we need that federal stockpile to be able to fulfill our state stockpile. I was pleased that a request I made to the president will be granted, and that is that we change our national priority system so that we can get personal protection equipment in the state of Washington. Previously, the system essentially had an allocation as a certain percentage to each state, essentially on a percentage of population basis. I argued that that is not adequate to the task because we have 700 plus infections right now, and West Virginia essentially has none. So I believe the president will change that prioritization, and he said he would shortly, and I think this will facilitate Washington getting more personal protection equipment as soon as humanly possible. So that was helpful discussion, and I appreciate it. So here's kind of the rule going forward for all of us. It doesn't matter if we're a business leader or a working person or a grandparent or a grandchild. If we are living a normal life right now, we're just not doing our job as Washingtonians. It's much, much too dangerous. We can't do that anymore. We need to make changes to our personal and family lives, regardless of size. And think about where you're seated in all occasions. We have simply got to limit the number of people who come in contact with this virus. 6 feet between us ought to be the rule in every circumstance. Now, I want to say something really strong to some of our most loved ones. And those are the people who are age 60 and over, and those people who have some underlying health condition. You are at substantial risk because of this virus. Let me give you a reason I say that. We are fortunate that our younger population has a very low rate of infection or mortality if you are infected. The most recently available information is that if you're under 50, you might have a mortality rate of 0.4%, and it gets lower as you go lower on the age chart. But if you were over 80, the mortality rate can skyrocket to 8 to 18%. From the 70 to 79 provision, it is 8%. And if you were over 80, it is 14.8%. Anyone in this category, I want to make a very personal and gubernatorial request to you. You need to self-isolate, starting right now. And that means you need to change the way you operate your life. If you've every Saturday met your buddies after a basketball game like I did for 20 years, you just can't do that anymore. If you've wrestled with your grandchildren every Saturday morning like I've done for years, you just can't do that anymore. If you've gone to a museum with your friends on a Sunday afternoon, you just can't do that anymore. Now, this is not a legal statement by the governor, but it is as strong a recommendation as I can possibly make. And we as Washingtonians have to help our loved ones follow that admonition. If your grandma is going out, she's not going to go to the restaurant anymore because of this rule, but if she's going to an art gallery, no, you need to talk to her and say you're not going to do that for a couple weeks at least, and probably longer. And if you see them playing with your grandkids and wrestling on the floor, you can't do that. And we need to save these people. Because if we can keep this group of people out of circulation for the next several weeks, we're going to save dozens, if not hundreds, of our loved ones. So that group of people, I strongly recommend self-isolation at this moment. Now, those of us who are under 60 and are healthy, do not have underlying conditions, I also agree that you ought to look at your life and figure, what do I really have to do when I leave my house? I mean, what is really required for my family's health or general living? And if the answer is you really don't have to do it, stay home. You just got to stay home unless it's absolutely necessary to go out. And this is tough. Look, we're social animals. We want to be with our loved ones. We've spent, in my case, 69 years offering my hand to anybody I meet. But we can't do that anymore. Okay. I want to address our medical situation. We are very aggressive attempting to build our surge capacity in our hospital system. This is very difficult because unless we are successful doing what I'm suggesting, which is everybody stays 6 feet away from everybody else under all conditions, we're going to have a real strain on our hospitals. We have a plan to do all we can in this regard, but everybody's got to pitch in, including, frankly, you are going to, if you have really non-necessary surgery that could be delayed without a risk to your health, you probably are not going to be having those procedures for some period of time. And we're having discussions with our hospital and medical community about that just actually this afternoon. I want to thank Dow Constantine, Jenny Durkin, Dave Summers, and all the leaders with me. And I want to say that I'm really proud of what Washingtonians are doing right now. They are responding, and that's been very pleasing to me. I just want to finish by something that really inspired me the other day that I hope we keep in mind. Our Superintendent of Public Instruction, Chris Rakedahl, when we announced our school closure, told a little story about how he was watching a 14-year-old girl playing volleyball. I presume it was his daughter, and she really loves playing volleyball. And he said it was kind of troublesome to him that he realized that was the last volleyball she was going to get to play for some period of time, and she really loves the game. But as soon as he had that thought, he also realized she was going to get to play again. There was going to be a day where everybody gets to play volleyball and basketball. There is going to be a day when we can be close to our grandparents. That day is going to come. We are going to get through this. We do have the ability to control our own destiny, and I'm confident we will fulfill that. I want to ask everybody to help out in this regard. With that, our next speaker is Jeff. Are you coming up, or who's next here? Dave? Yes, thank you. Dave Summers.